Assalamu alaikum. Welcome to another edition of Ramadan for Better Health. Thank you for tuning into the program, and happy Ramadan to you. We hope that so far this year, in the holy month of Ramadan, that you've been successful in your fasting, inshallah. May Allah accept all of our efforts. Today, we're going to be talking about the issue, a very serious neurological issue, epilepsy. We're joined by a specialist in the area of neuroscience. He is a consultant of neurosurgery. This is Dr. Ahmad El-Sharkawy. Assalamu alaikum to you, doctor.
Alaikum salam, Mr. Ali, and thank you for inviting me today. And happy Ramadan for all Muslim brothers all over the world.
Thank you so much for being here with us.
Thank you.
All right, so we're talking about something. Epilepsy is not a light issue. It's a very serious issue.
Yes.
Talk to us about what is epilepsy.
Yes.
Yeah.
As you told, epilepsy is a serious neurological disorders which affect about 1% of people all over the world. That means that about 65 million people all over the world suffers from epilepsy. Epilepsy is characterized by frequent epileptic seizures. These seizures range from brief periods of lack of attention to a more vigorous shaking, during which the patient may be hurted due to hitting by something hard or like this.
Yeah.
Epilepsy has so many causes and so many types. We can broadly classify epilepsy into two major types. The first type, which constitutes about 60% of all epilepsy, which is convulsive type.
Convulsive.
Which means that the patient has convulsions, means that shaking of muscles of his body. And during this attack, he may lose consciousness, and this attack is followed by about a few hours of lack of muscle tone. He may become flaccid for
weak, not able to move.
Yes, he is not able to move for a few hours. After that, he gain his power and his consciousness. The second type, which is non-convulsive type, which constitutes about 40% of all epileptic patients. The patients may have loss of consciousness, but the muscles of her body is not contracted and not shaking during this attack. It has also many types, like atonic epilepsy, absence epilepsy, which occur most commonly in children. The patient may, for few minutes, lack attention for only 3 or 5 minutes. After that, he can regain consciousness again, and he is not aware that he has epileptic.
So the sufferer from epilepsy, in these mild cases, they're not aware of what they've experienced.
Yes, he doesn't know what happened to him after regaining consciousness from this epileptic attack.
Okay, so we had, so far you said there are 3 types. Convulsive, people have these seizures, violent movements, and they could hurt themselves or others. Non-convulsive, and is there a third category?
Yes. Third is absence epilepsy.
Absence of epilepsy. Okay, all right. Let's talk about the causes. Can it be introduced by the environment or diet, or is it only hereditary?
We can classify epilepsy also into primary or genetic epilepsy, which means that the patient acquire him by genetics from hereditary causes from his relatives due to abnormal genes in his
is this the primary cause?
Yes,
the
this
genetic?
is the primary. Due to genetic disorders which occur during fetal life, intrauterine.
I see. Doctor, I'm sorry to interrupt you, Dr. Ahmed. We have a video that we're going to show, and then we'll come back to continue with the doctor.
Okay. This video show one type of epilepsy, which is a convulsive type. The patient starts to suffer from abnormal contractions of muscles, may start by muscles of the face, muscle of the upper limb or the lower limb, according to the area of the brain which is affected by the epileptic focus, the abnormality.
We just saw a video. He was actually having he was not acting.
Yes,
this was a real epileptic seizure.
Yes, he is not acting. He is real convulsive fits. The patient loses consciousness and starts to contract, or there is some abnormal contractions of muscles, maybe start in the face, or the upper or the lower limb, and this is due to abnormality in the electricity of the brain. The brain maybe abnormally have an area or focus of abnormally hyperactive cells. This is the initiation, or this is the source of epileptic attack. After that, this wave of hyperelectricity may spread all over the brain and may cause a full-blown picture of epileptic seizure.
Okay, so obviously this is a very serious thing. It's very difficult, I can imagine, for people to have normal lives as Muslims. Imagine someone in the congregational prayer who, and these are unscheduled outbreaks, right? These seizures. Can they feel these seizures when they're coming on to control where they are when they happen?
Yes, during the seizure, the patient may have some risk of injury if he has been hit by any hard object. So the surrounding or the attendance of the patient should help him not to hurt him, and should do some precautions and some maneuvers which can save the patient's life. During the attack, the attendant or the relative of the patient should roll him on his side, not to aspirate fluids which come from vomiting. So he should bring the patient on his side. This side is called the recovery position.
So vomiting is common during these seizures?
Yes, vomiting is common during the seizure, especially if the attendant or the companion of the patient put something in his mouth to safeguard against biting his tongue. This something, whatever tongue depressor or bite block, may initiate vomiting for the patient. So it is not recommended to use any objects or put any objects in the patient's mouth, not to stimulate vomiting. Just turn him on his side. If vomiting occurs, he will not come into the lung.
You know, when we feel hungry, we have a sensation in our bodies, and we know that we should go eat or relieve ourselves in the toilet. We have the sensation. Do they have any sensation, any feeling in the body before the seizure comes, or does it just happen upon them without their...
In some types of epilepsy, patients may have some sort of symptoms, mild symptoms, which occur, like smashing, dropping of the angle of the mouth, like tingling in the or numbness in his arms.
This is a sign that it could be coming.
Yes, and after a brief period of time, he will go through the full-blown picture, but he cannot prevent it.
Yeah. Wow. All right. So let's talk about the treatments, the different approaches that doctors like you and your colleagues. How do you treat patients who have epilepsy?
Treatment depends on the type of epilepsy the patients have. If the epilepsy is due to organic cause or a specific cause in the brain, like tumor, like hemorrhage, like any vascular disorders like AVM, aneurysm in the blood vessels of the brain, we should treat the cause first to alleviate the epilepsy. But in the first type of epilepsy, which have no specific cause, we should start by medical treatment, drugs. Drugs, there are two lines of treatment by drugs. We can use drugs to alleviate or to abort the attack, like sedatives and hypnotics, which drugs or vials that make the patient go to sleep, and the other types of drugs which the patient can take to prevent or to delay the attacks. And there are many different types of drugs the patient can use. And fortunately, about 70% of patients can be controlled.
70%?
Yes, can be controlled on drugs.
Wow. Oh, that's a very high rate of success.
Yes.
If they take the tablets, they can live a normal life without.
Yes. Yeah, but in this remaining 30% of patients which can be controlled on drugs, there is another lines of treatment like surgery. As I said before, if the patient have brain tumor and this is the cause of epilepsy, we can, after removal of the brain tumor, the epilepsy will go away. And if there is blood collection in the brain, and after removal of it, the epilepsy can also go away. And in certain types of primary epilepsy without an obvious cause, there is some operations we can do for the patients to help him to get rid from anti-epileptic drugs. We can remove the epileptic focus from the brain after doing some investigations to diagnose it. We can also stimulate certain areas in the brain by electrodes connected to a stimulator, connected to a battery, like a battery, which gives impulses, electric impulses to certain areas in the brain.
This is electrodes on the outside of the head?
Yes, the stimulator or generator is outside the head, maybe in the anterior chest wall, connected to electrodes like very, very minute wires, which is inserted in the brain in certain areas. If we give certain impulses by a specific voltage, we can successfully control the fits without treatment.
Wow.
Or even the drugs which the patient can take, we can decrease the
Dr. Ahmed, I'm very optimistic. I mean, it sounds like there's a lot that you can do to intervene to stop these epileptic seizures.
Yes.
All right, so we'll take a short break right now and continue the program with our doctor. He's a specialist in neurosurgery. We'll take a short break and then come back to finish out the program. Assalamu alaikum. Welcome back to the program Ramadan for Better Health. We've been talking about epilepsy, a very serious neurological condition. But the good thing is that the doctor here with us, he's a specialist in neurology, Dr. Ahmed, that there's a very high rate of success in treating the patients who suffer from epilepsy.
Yes, as I told you, more than 70% can be treated completely by drugs. And if the remaining part is 30%, if the drugs failed, we have many options for treating these patients, like surgery. And if surgery is not suitable for them, we can do neurostimulation by electrodes inserted in certain areas in the brain.
So it's safe to say that more than 90% can some way or another be effectively treated?
Yes, more than 90% can be treated from epilepsy.
Very, very, very good. Very good news. We talked about the treatments and a little bit about the condition itself. What about the diagnosis of epilepsy?
Yes, the diagnosis starts from the clinical picture of the patients. The characteristic attack of the patient. We suspect from it that the patient have epilepsy. If the patient has loss of consciousness, convulsions, and shaking of the muscles of his body, so we do more tests to be sure from the diagnosis. One type of tests we can do is to prove the disease itself. We prove the patient that has epilepsy, which can be done by what's called EEG. This instrument or this device can record the electricity coming from the brain and can accurately define the area of hyperactivity or area of abnormality, which is the cause of epilepsy. After that, we can do more tests and more imaging for the brain to define or to diagnose the cause, to show the cause of the epilepsy. As I told you, there is about 20% of cases which come from certain pathology in the brain, like tumors, like hemorrhage, like bleeding, like vascular malformations which occur in the brain. By the imaging tests, we can define accurately the cause of epilepsy. We can do for the patients CT, MRI, CT angiography, which shows to us the details of the blood vessels of the brain and can diagnose any abnormality in them.
So it sounds like what I didn't catch before, something you just said, is that you may not be born with it. You could have a trauma that can cause.
Yes, trauma. One of the most common causes of secondary epilepsy, because trauma may cause injury to the brain cells itself. This injury can irritate the nerve cells in the brain and make it to be hyperactive and discharge more electricity, which is a cause of epilepsy.
I see. All right. Let's connect this subject to the title of our program, Ramadan.
Yes.
The Muslims are fasting the holy month of Ramadan. I think it might be obvious to me how it could affect. What kinds of things? Talk more about how epilepsy can affect sufferers who are Muslims during the month of Ramadan.
Many people or many patients with epilepsy may have risk of increased seizures during the Ramadan because of many causes. First one is the change in the time of drugs which is the patient can take. During Ramadan, as there is abstinence from drinks, from food, and from oral drugs for more than 12 hours per day. These long hours may lead to decrease in the level of the drug in the blood of the patient, and this may cause risk of seizures or risk of epilepsy to increase. Also, the changing the sleep hours and sleep rhythm during Ramadan may cause the patient to have more seizures or more attacks of epilepsy. The decrease in the blood sugar level which occur during fasting hours also may initiate or may irritate or may lead the patient to have an epileptic attack. So we advise all patients with epilepsy to consult their doctors before starting Ramadan fasting to adjust the dose and to give him the advice for safe fasting. And also there are many people which cannot fast during Ramadan. People which take drugs 3 times daily or 4 times daily. If we deprive them from the medication for more than 12 hours, they can be at high risk of having the attack. So in these patients, we advise them not to fast because of fasting may cause increased risk of having the attack during Ramadan day. And it all depends on the every individual patient. So we advise them to consult first their treating doctor, and they will, according to the condition of the patient, they will give the accurate advice.
And this is something that they don't have to face potentially every year, every Ramadan season.
Yes.
Because didn't I understand you correctly that these patients could eventually come off of the medications? They could reach a point where they no longer need the medications. Is that correct?
Yes, but medications for epilepsy and drugs should be taken for epilepsy for more than 2 years. So the patient may have to take the drug for many years to be alleviated, to be cured completely from the epileptic attack.
Okay. We have a phone call now. We're joined by Dr. Mukhtar Mahdi. He's a pediatrician, a pediatric surgeon. He's going to be talking with us. Assalamu alaikum to you, doctor.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi. Doctor, thank you for calling in to join the program.
Our pleasure.
What would you like to talk about to contribute to this discussion?
We will speak about congenital anomalies or congenital birth defect in children, and now we see increased prevalence of it. We should know that it is a congenital malformation or anomaly defined as a structural or functional anomaly that occur during intrauterine life and can be identified prenatally or at birth or later in life. And this is the good news, that the mother can know if the baby has a birth defect in the uterus before giving birth.
Mm-hmm. Okay, so we're talking about congenital anomalies in children, and this means that they were born with certain conditions?
Yeah, born with a structural or functional anomaly, and we could know that before they even get to life, prenatally in the uterus of the mother.
Okay.
There are several causes and risk factors for having a congenital anomaly, because we hear all of the mothers asking, what made my child have that? Actually, about 50% of congenital anomalies cannot be linked to a specific cause. We call it idiopathic, without having a certain cause. But we have some risk factors saying that when you increase the factor of having a congenital anomaly, like the socioeconomic status. We see that in low socioeconomic status and countries that have a low income, about 49% of severe congenital anomalies occur in these specific socioeconomic status. Also, the genetic factors. If you don't know who are to blame the parents, especially parents who are related by blood infections. Maternal infections such as syphilis, rubella are significant cause of congenital anomalies in low and middle income countries. That's why we tell the mother that the first trimester and during pregnancy, you should take good care of your health. That brings us to maternal nutritional status, because it has a major effect. What the mother eats in the first trimester will affect the health and the formation of the baby, especially iodine deficiency, folate insufficiency, obesity, and diabetes linked to our congenital anomalies. If the mother has a good balanced diet, having these supplementary medications in the first trimester and avoided having infection and taking drugs without the doctor's orders, you will have less of these congenital anomalies. Also, environmental factors. We live in a society that has many pollutants around us. We are exposed to certain pesticides, chemicals, and all of that may affect the health of the child.
Okay. Dr. Mukhtar Mahdi, he's a pediatric surgeon. Dr. Mahdi, thank you for calling in to give us this contribution to this discussion. He's telling us that it's very important for the mothers, the expecting mothers, to be very careful about the environments that they allow themselves to be in, including the month of Ramadan, because it has a direct impact on the health of, obviously, on their growing children. Assalamu alaikum to you, Dr. Mukhtar. We'll be in touch with you in the future. And we have just a couple minutes to finish the program here, continuing our discussion about epilepsy. What kinds of things would you advise for patients, even those who have been successful in overcoming the epilepsy, for the fasting month? Any special concerns they need to be aware of for the month of Ramadan?
Yes, we can advise people who have epilepsy first to ask their doctor, because every case has its precautions, and the treating doctor is the only one who can advise the patient for safe fasting. But in generally, patients with epilepsy should avoid any stress in Ramadan, should have sufficient sleep hours during Ramadan, and also he should avoid decrease in the blood glucose level by taking much more food before starting fasting, rich in sugars, because decrease in the sugar level in the blood during fasting hours may initiate the epileptic
seizure
attack.
I have a question. I've heard, that flashing lights could have an effect on. Is this true? And
yes, this is true. Any irritant stimulus may precipitate the attack of epilepsy, like flashing lights, like loud noise, like any stress the patients may suffer during his daily activities may precipitate the attack.
So this is something to be aware of when celebrating the Eid holidays and the month of Ramadan. There are lots of lights, especially fireworks that are being, and this kind of thing. So be careful according to. And we appreciate you, Dr. Ahmed, for joining us. He is a consultant in neurosurgery, Dr. Ahmad El-Sharkawy. We will end our program for tonight. Inshallah, we'll be back to continue our program, providing information to help you have a more fruitful and successful fasting month of Ramadan, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.